Hey everyone, my name is Johnita. Benjamin, Haley, Jessica, Joseph, and myself are going to be presenting on lisdexamphetamine this evening, also known as Vyvanse. Next slide, please. I'm going to start with discussing pharmacology. Amphetamines act by triggering release of norepinephrine and dopamine and by inhibiting reuptake of both transmitters. Vyvanse is a prodrug composed of dextroamphetamine covalently linked to L-lysine, which means it is not in its active form until administered. Once administered, Vyvanse undergoes rapid hydrolysis in the liver and intestine. It is converted into its active form through separation of L-lysine and dextroamphetamine in the bloodstream, leaving behind the active form of the drug, dextroamphetamine. Once the drug is in its active form, inhibition of dopamine and norepinephrine reuptake occur, allowing them to be released into extraneuronal spaces. Most pharmacological effects result from the release of norepinephrine. These actions take place in the central nervous system and peripheral nerves. If inhaled or injected, hydrolysis will not take place, therefore the drug is not effective by these routes. Next slide, please. This slide shows us the receptor action of Vyvanse. Vyvanse targets 7 different receptors in the human body. It inhibits synaptic vesicular amine transporter, dopamine transporter, norepinephrine transporter, serotonin transporter, as well as MAOA and MAOB. By inhibiting these target receptors, Vyvanse helps to maintain the 3 main neurotransmitter pathways: dopamine, norepinephrine, and serotonin. It also plays a role as a neuromaintenance agent since it inhibits MAOA and MAOB. Vyvanse activates transamine associated receptor 1. The pictures on the slide show how blockade of the receptors prevent reuptake of dopamine, norepinephrine, and serotonin. Next slide, please. Some of the pharmacological effects of Vyvanse are listed here. In the central nervous system, amphetamines have prominent effects on mood and arousal. They increase wakefulness and alertness, reduce fatigue, elevate mood, and boost self-confidence and initiative. Stimulation of the medullary respiratory system increases respirations. Effects on the hypothalamic feeding center decreases appetite. And it can enhance analgesic effects of morphine and other opioids. In the cardiovascular system, effects occur secondary to release of norepinephrine from the sympathetic neurons. Norepinephrine acts in the heart to increase heart rate, atrioventricular conduction, and force of contraction. Norepinephrine promoted constriction in the blood vessels can lead to hypertension. With prolonged use, patients may develop a tolerance to elevation of mood, suppression of appetite, and stimulation of the heart and blood vessels. Chronic amphetamine use can create physical dependence. If medication is withdrawn, abstinence syndrome will follow. Because of the euphoric effects, amphetamines have a high potential for abuse. Next slide, please.
Attention deficit hyperactivity disorder is a neurodevelopmental disorder characterized by a persistent pattern of inattention, hyperactivity, and impulsivity that significantly impairs daily functioning. The precise pathophysiology of attention deficit hyperactive disorder remains elusive, but it is well established that the disorder involves the dysregulation of key neurotransmitters, particularly dopamine and norepinephrine. These neurotransmitters are crucial for the function of several brain regions, including the prefrontal cortex, cerebellum, brainstem, and basal ganglia. These are integral to the regulation of behavior and executive function. Abnormalities in dopamine and norepinephrine signaling in these regions are thought to underpin the hallmark symptoms of ADHD. Stimulant medications have served as the cornerstone of ADHD treatment since the 1930s. However, while stimulants have demonstrated efficacy in symptom management, their long-term effectiveness may be compromised by adverse side effects or the development of tolerance. Furthermore, the potential for abuse and dependence may remains a significant clinical concern. Binge eating disorder is a psychiatric condition characterized by recurrent episodes of compulsive overeating, often accompanied by feelings of loss of control, guilt, or distress. The neurobiological underpinnings of BED are linked to the dysregulation of reward pathways involving dopamine. The hypothalamus, substantia nigra, and ventral tegmental area are key brain regions implicated in the pathophysiology of BED. With abnormalities in dopamine signaling central to the disorder's manifestation, genetic factors, including the DRD2 gene, encode for dopamine receptors, also may contribute to the disorder. Dysregulation of the dopamine system in BED may lead to heightened reward sensitivity, which in turn reinforces compulsive eating behaviors, creating a vicious cycle of binge eating, increased dopamine release, and reinforcement. In both ADHD and BED, the role of dopamine and norepinephrine is pivotal. Dopamine is a neurotransmitter involved in mood regulation, attention, motivation, and reward processing. In ADHD, dopamine deficiency contributes to the symptoms of inattention, distractibility, and impulsivity. In the case of BED, the dysregulated dopamine is associated with eating behaviors, alert, altered reward pathways, binge eating, and cravings. Similarly, norepinephrine is involved in both disorders and regulates arousal, attention, and emotional responses. In ADHD, norepinephrine imbalance impairs focus and attentional control. In BED, norepinephrine dysregulation sets the emotional stage for the compulsive drive to binge eat. Vyvanse is an indirect sympathomimetic prodrug that's converted to dextroamphetamine. When taken orally, the metabolite's small molecular size easily crosses the blood-brain barrier and increases the presynaptic availability of dopamine and norepinephrine by promoting their release and inhibiting their reuptake. This action results in enhanced communication between the brain regions involved in executive function, impulse control, and reward processing, improving the regulation of attention and behavior. In ADHD, Vyvanse improves attention span, reduces impulsivity, and mitigates hyperactivity by balancing the dopaminergic and noradrenergic signaling. In BED, Vyvanse diminishes the frequency of binge eating episodes by normalizing the reward system function and reducing impulsivity, thus addressing the core pathological mechanisms underlying the disorder.
The normal dosing guidelines for the two disorders Vyvanse is used in. So in ADHD, this is used in children age 6 and older and for adults. It comes in two forms, capsules and chewable tablets. The initial recommended dose is 20 to 30 milligrams once daily in the morning. We may increase in increments of 10 to 20 milligrams per day at 3 to 7 day intervals until the optimal response is obtained. The recommended dose is 30 to 70 milligrams per day. The maximum daily dose is 70 milligrams per day. In binge eating disorder, this is for adults. It also comes in capsules and chewable tablets. The initial dose is 30 milligrams once daily in the morning. We can increase in increments of 20 milligrams per week. The recommended dose is 50 to 70 milligrams per day, and the maximum dose is 70 milligrams per day. And then I have a picture down here of a Vyvanse prescription bottle. It gives us the dosages of the capsules and the chewable tablets. The only difference is that the capsules come in 70 milligrams, whereas the chewable tablets do not. When we're educating our patients about the capsules, we want to tell them to swallow the capsule whole. If they have to open the capsule, they can empty and mix in the entire contents with yogurt, water, orange juice. The content should be mixed until completely dispersed, and we need to tell them to consume the entire mixture immediately. It should not be stored. And for the chewable tablets, they should be completely chewing before swallowing. Next slide. Some dosage considerations. So dosage in patients with renal impairment, the maximum dose should not exceed 50 milligrams once daily. In patients with end-stage renal disease, the maximum recommended dose is 30 milligrams once daily. We can use this in our geriatric population. The dose selection should start at the lower end of the dosing range, and we should consider the possibility of decreased hepatic, renal, and cardiac function. Lastly, acidifying and alkalinizing agents, they alter urinary pH and can impact urinary excretion, which alter blood levels of amphetamines. Acidifying agents such as ascorbic acid decrease blood levels, and alkalinizing agents such as sodium bicarb increase the blood levels, so we should be adjusting dosages accordingly. Next slide, please. Here is our mock script. So our patient is Johnny Depp. We have his date of birth and contact information there at the top. The prescription for Vyvanse, 30 milligrams. We're dispensing 30 capsules. The directions: take 1 capsule each morning for ADHD with or without food, and swallow capsules whole. And this can be substituted with a generically equivalent drug and refill 0 times due to the federal regulations on Schedule II controlled substances for safety and to reinforce follow-up appointments that they're being scheduled and completed. And then we have the date, the provider's signature, his name, license DA, MPI number, and then the clinic contact information. Next slide.
So this slide, we will review the side effects of Vyvanse. Stimulation of the central nervous system can cause insomnia and restlessness. By suppressing appetite, weight loss can occur. At recommended dosages, a small increase in heart rate and blood pressure can occur. For most patients, these increases lack clinical significance, but for patients with pre-existing cardiovascular disease, arrhythmias, angina, or hypertension may occur. Stimulants must be used with extreme caution in patients with pre-existing cardiovascular disease. Excessive medication use can produce a state of paranoia psychosis characterized by hallucinations and paranoid delusions. This can mimic schizophrenia. After amphetamine withdrawal, psychosis usually resolves itself spontaneously within a week. With regular amphetamine use, tolerance develops to elevation of mood, suppression of appetite, and stimulation of the heart and blood vessels. Chronic amphetamine use can produce physical dependence, and if medication is abruptly withdrawn from a dependent person, a withdrawal syndrome will occur. This includes symptoms of exhaustion, depression, prolonged sleep, excessive eating, and a craving for more amphetamine. Because amphetamines can produce euphoria, they have a high potential for abuse. Psychological dependence can also occur. By a mechanism that is not well understood, amphetamines can enhance the analgesic effects of morphine and other opioids. Use of Vyvanse with other stimulants, like caffeine, can increase the risk of adverse effects. MAOI use within 14 days can cause a serious drug interaction to occur, and SSRIs and SNRIs can interact with Vyvanse and cause serotonin syndrome. Next slide. Whether or not to obtain an EKG prior to presenting this medication is debated due to a 2008 statement from the American Heart Association due to 14 children, 5 with heart defects, suddenly dying while using Adderall. However, given that millions of children have used the drug, it is argued that the death rate is no greater than it would be expected for a group of this size, whether or not Adderall was being used. There is no data showing that limiting the use of stimulants in children with heart defects will protect them from sudden death, nor data showing that screening for heart disease with an EKG before starting stimulants will be a benefit. However, if there is evidence of heart disease or evidence of hereditary cardiovascular defects, an EKG may be appropriate for a child or adult patients. Growth suppression is thought to be secondary to weight loss in children, so drug holidays are recommended by some clinicians for children and mainly takes place on weekends and summers. We also need to consider renal impairment, as Haley covered, and it is unknown whether this medicine will harm an unborn baby. However, taking the medicine during pregnancy can cause premature birth, low birth weight, withdrawal symptoms in the newborn baby. It can pass into breast milk, and it may cause side effects in the nursing baby. Next slide. Patient and family education points include that this medication is habit forming and proper storage is needed, such as keeping the medication in child-proof bottles and in a locked cabinet. This medication should not be shared. Because of its abuse potential, measures such as pill count should be implemented for child and adult patients. Patients should be screened for history of medication abuse, as a non-stimulant medication may be a better option for this patient. In regards to administration, chewable tablets should be chewed completely before swallowing. Capsules should be swallowed whole, or the entire contents should be mixed in a small amount of yogurt or other substance and consumed immediately. It is not effective if inhaled or injected, which does reduce its abuse potential. Extra doses should not be taken if a dose is missed. The medication should be taken in the morning to avoid sleep disturbances. Symptoms that must be evaluated immediately by a provider include the development of cardiovascular symptoms, such as chest pain, lightheadedness, dizziness, or shortness of breath, signs of serotonin syndrome, which includes an altered mental status, agitation, fever, loss of coordination, or nausea, vomiting, and diarrhea, and signs and symptoms of circulation problems, such as unexplained wounds on your fingers or toes. Next slide, please.
All right, so for our clinical scenario, we're working as a nurse practitioner in a clinic. A 21-year-old female patient presents to the primary care clinic with a chief complaint of persistent struggles with her ability to focus and pay attention while doing schoolwork. As a child, she was diagnosed with attention deficit hyperactivity disorder. She admits her symptoms, such as being easily distracted and restless, have been consistent up into adulthood. She was previously prescribed Ritalin, but stopped using it due to appetite suppression and mood swings. So she has a prior diagnosis of attention deficit hyperactivity disorder, treatment plan. So due to the unpleasant side effects with prior stimulant usage, we decided to prescribe her Vyvanse, which is a prodrug and allows a more gradual onset of effects, possibly providing fewer side effects. We're going to instruct her to begin by taking 30 milligrams once daily in the morning. We're going to educate her on the abuse and misuse potential, as well as the possible side effects. And then along with our prescription, we want to refer her to cognitive behavioral therapy. In 2 weeks, we're going to follow up with the patient. We're going to assess the effectiveness of the medication, as well as if there's any side effect management that needs to be taken care of. We're going to assess for changes in her blood pressure, heart rate, weight change, and as well as changes in sleep pattern. And then we're going to discuss the importance of medication adherence, strategies to improve it if needed, and not to stop the medication abruptly. Next slide.